Now, this morning, we're going to be discussing a topic that many may think may be helping their pets and livestock, but is actually hurting them instead. These are fake vets, veterinarians who pose like doctors of the animal world without completing the required training. And joining me to talk more about this is President of the Trinidad and Tobago Veterinary Services and owner of Tobago Animal Hospital, Dr. Paul Crooks. Dr. Crooks, good morning. Thank you so much for joining us.
Good morning. Thank you for having me.
Of course. Now, these impersonators, Dr. Crooks, how did they come about?
Okay, so there are a few ways. Usually what we have in vet medicine and with a few of these impersonators, it would be that they perhaps worked with vets in the past and they tend to gain a false sense of confidence and familiarity with the medicines that are used or with the clients or overall with what they think would be routine practice. And therefore, they branch out and start practicing vet medicine on their own. Here in Tobago, for example, we've had instances where persons were assistants to vets. In the case of government employees, sometimes they're stock workers, sometimes there's something called animal health assistants. And then persons realize that these people are working alongside the vets. They think vet medicine is an easy thing. And therefore, these people, because they've worked with vets, many clients think that they are vets. And
Right.
either the assistants don't indicate that they are not trained vets, or the assistants go along with it. Sometimes people in the neighborhood call them Dr. this or Dr. that. Here in Tobago, we have a situation in Bon Accord where there's somebody who comes around and many people know he's not a vet. But if you talk to them casually, they would say, yes, the vet man came, the vet man saw the cow, he saw the dog, he given some shots, and now he said that I need to call you because he can't handle it.
You may
That's the
have
kind
done
of
something wrong.
situation.
Yes.
In many cases, that's what's happened. Yes.
And so, I think what I'm hearing is that you need a certain level of training to call yourself a vet. And is it that this person needs to go to a certain school, or is it that they need to go to the school and then also get the practical training before they can call themselves a vet?
So a veterinarian is trained in an equivalent way to a human doctor. And the breadth of what we do cannot be overemphasized, sorry. We study pathology, we study public health, we study surgery, we study microbiology, bacteriology, pharmacology. When a veterinarian graduates from vet school, he is so broadly trained that he is able to tackle really any medical problem in any animal species, even if it's just at a basic level. The animal health assistants or stockmen or laborers who would have worked alongside vets in whatever field they would have worked, those persons lack the capacity to be able to perform surgeries or to determine if they're using an antibiotic and not using it well, what are the possible consequences for the misuse of this drug. And because of that, because they lack that training, it means that the guidance that they provide is going to also be lacking. And in Trinidad in particular, we have persons who are not veterinarians who have been performing surgeries. And we've had complaints about poor surgical outcomes. We've had complaints about animal welfare. We've had animals that die. We've had animals that bleed to death. We've had animals that are conscious during surgery. And we're talking about in Trinidad and Tobago, where there is an abundance of qualified veterinarians who are able to do high quality surgery that would prevent these animals having this unnecessary suffering. And
Now,
we have to look at some of the factors as to why that happens.
Of course. Now, one of the things you'd have mentioned, Doc, is the fact that these fake vets are getting access to medication so easily. Is that a concern that they're getting access to the medication? And then isn't there something that you have to be a certified veterinarian, for example, before you can go to access this sort of medication? How are they getting it so easily?
So that's a question that we have yet to answer. And, I'd like to point out that this impersonation cottage industry that we've been seeing in vet medicine is not just in vet medicine. Our dental colleagues have also been really complaining about it. And it's something that we're all having a hard time dealing with. But in terms of access to drugs come into Trinidad and Tobago a few ways. So not only are there major suppliers who, to their credit, very often require prescriptions or that you prove that you are a registered professional in order to be able to participate or purchase from them. The dentists, I'm seeing there's some issue here.
Of course.
But the but the drugs are also brought in suitcases and sold at pharmacies or from medical professionals, and these drugs are not necessarily regulated. Unfortunately, our public health professionals simply are burdened by the amount of drugs that they are to check, the different types of drugs that are produced annually. The numbers become so excessive that there's simply no way to keep track of all the different types of drugs, to know which ones need to be regulated, which ones are antibiotics, what classes of drugs they are. And therefore, because drugs are brought in and produced faster than they can be regulated, we are at the point where many drugs are brought in and it's illegal because our law doesn't even know that these drugs exist. It's not technically illegal to bring them in, and these drugs are then distributed. Also, we know that there are ways, although we don't know how. There was a huge ketamine bust, I think last year, where illegal ketamine for animal use was found, and this ketamine was being purified into a solid that's used for illegal use.
Illegal usage, yes.
Yeah, and so basically we have a situation where people are getting access to these drugs. We don't know how. And at the Trinidad and Tobago Vet Association, we've been trying to work alongside our suppliers to ensure that we have prescription requirements for certain drugs, that many of the drugs are not over the counter, but still these things happen. Vaccines in particular are sold, and vaccines should never be administered by a non-veterinarian.
Of course.
But vaccines in particular are being sold and administered at pet stores by many pet store owners. And many times animals are already sick when the vaccines are given. Many times vaccines are not stored adequately, so the vaccines don't work. There are a number of factors that have to be considered that the veterinarian would be aware of, but not necessarily the layman.
Yeah. And Dr. Cook, so what I was thinking about is there are these people who know for a fact that they're going by fake vets, yet they continue to have these fake vets come and take care of their pets, take care of their livestock, take care of their animals. Why do you think that is?
A number of factors. So one of the first things I would say that we see here in Tobago is a sense of familiarity. There's the man down the road, and in Tobago especially, there's still a very neighborhood vibe.
Yeah.
So because this person is in the neighborhood and because your neighbor talks about him and that person is who your neighbor calls to see his sheep, you're going to call that person as well. So there's a lot of word of mouth marketing here. Also, these impersonators tend to offer their services much more cheaply than they should. A veterinarian cannot ever match the prices that these persons do because they're simply offering a trade and not the expertise. As a vet, I wrote an article a few months ago about why paying your vet is important, but we are trying to raise the standard of veterinary care in Trinidad and Tobago. We want vets to be able to offer x-rays, to offer ultrasound, to offer MRI. We want vets to be able to do surgeries at a level where the animals are safe in a very clean environment. These are the types of things we want to achieve, and vets will need to be paid well
Well, to
to
achieve
be
those
able to
things. Yes.
afford these things. With these impersonators, they have no goal of trying to improve what they do and what they offer. So basically, what we see is that these people come by and they just give shots. And that's one of the red flags. When an owner asks me, how do I know that this person is a vet? There are a few ways the Trinidad and Tobago Vet Association has for its members sent out identification cards. Of course, you can simply ask the person, are you a qualified veterinarian? Let the person lie, because we have to see from, if we were going to pursue the law, that we have to see that these persons purport to be a vet. Not that you necessarily believe that the person is a vet, but that the person claims to be a vet. So let the person lie, ask them to see their qualifications, say from which school did you graduate. These are the kinds of questions that would empower the client to know that they're making a good choice for their animals. Having asked those questions,
yes.
Sorry?
Yeah, I know. I was just going to say, I was just going to say, Dr. Cooks, quickly, of course, because I know that you mentioned standards, right? That vets want to be able to complete certain services and standards. This seems to obviously be bringing down the credibility of the profession. And then, so how do you work around that as well?
Well, that's one of the things. So I'm going to say, on the whole, as vets, we do also have to communicate better. When a client is seen by a qualified veterinarian, there shouldn't be a doubt in the client's mind that this was a vet. If a client calls, as an example, because a cow has red urine, when the qualified vet comes by, the vet should not just give shots. A vet should have a good client-vet relationship where there's a discussion about what are the possible diagnoses, or what is the final diagnosis? How do you confirm this diagnosis? How are the other animals going to be impacted? What is the prognosis? So what are the chances that this animal is going to return to normal function after the treatment course is given? So these are the types of discussions that should be had with a qualified vet. And the truth is that none of these veterinary impersonators are going to be able to give you that sense of feedback, that sense of broad knowledge, that sense of a holistic examination, holistic treatment, and holistic plan. And these are the kinds of things that clients need to look out for. Because if somebody comes by and just gives shots, whether it be a vet or not, that is a red flag. And the truth is that primarily, you're going to be encountering non-veterinarians who come by and say, I'm just going to give this shot and this shot, I'm going to give 3 shots, and they don't tell you what shots they are. And many times we see the owners and they say, well, the person gave a white shot and a red shot and a pink shot, and they give something in the mouth and they just went.
They themselves can't even clearly identify what was given. Yeah, and of course that 100%. Is a red flag that they should look out for. And Dr. Cooks, finally, for people who are new to owning pets, who are new to owning livestock, is there a certified board or a list that they should go to if it is they're looking for somebody to take care of their animals?
Right now, we are working on publishing an updated list of registered veterinary surgeons in Trinidad and Tobago. But the Trinidad and Tobago Vet Association, which you can find online on Facebook, absolutely, if you think you've encountered a fake vet, someone who's impersonating a vet, please let us know. Message us on Facebook, Trinidad and Tobago Vet Association, because we have been trying to clamp down. We have been putting out a list of names of persons who've been, it's suggested that they've been giving vaccines, or they've been examining animals, or they've been purporting to be vets, or they've been misdiagnosing and or performing surgery. So these are the types of things we're trying to be very, very active on, and to ensure that these types of situations are limited and mitigated. But we rely on the clients to give us that feedback. So please reach out to the Trinidad and Tobago Vet Associations on Facebook if you have any doubts.
Of course. Dr. Cooks, always a pleasure to have you in here and just sharing your experience, sharing your knowledge. Thank you so much for joining us on Now.
Thank you. Have a good day.
That was the president of the Trinidad and Tobago Veterinary Services and owner of the Tobago Animal Hospital, Dr. Paul Cooks, just reminding us to look out for those fake vets to ensure that we are treating our animals and treating our pets and livestock with the love and care that they need. You're on the Now Morning Show. We're going to take a quick break and be right back. Stay with us.